Hi, I am Dr. Ayyappan, Senior Surgical Oncologist of Apollo Cancer Centers, Chennai. I am going to talk to you about ovarian cancers. Ovarian cancer, which occurs in the ovary, which is a very important component in the female genital tract. Generally, ovarian cancers occurs in the elderly age group, but these cancers can occur even in the younger age group and in the middle age group also. But the variety, the type of cancer will be different in the younger age group when compared to that of the older age group. Generally, these patients, what are the risk factors when we talk about ovarian cancers? We call something as the early menarche, that is attaining the menstruation in the earlier age group, or late menopause. Some patients have infertility. They may be nulliparous, and patients who have had history of some other cancers before, they would have been treated for some other cancers. All these things, they fall into the risk factor for the particular individual. Generally, usually, the patients with ovarian cancer, 70 to 75% of these patients present out in advanced stage disease. The usual presentation will be distension of the abdomen, abdominal bloating. They will not be able to take food properly. They will be having vomiting. They will dislike their food. They will early satiety. As soon as they take some little quantity of food, they will feel fullness of the abdomen. Some patients present out with urinary tract symptoms. Some of them present out altered bowel habits. There will be usually loss of weight and, as I mentioned to you, loss of appetite. Advanced diseases, they have abdominal pain, pelvic pain, and they can also have bone pain, and other things will also be there in these patients. How do we diagnose these cases? Radiological investigations is very important in these patients. When I mention about radiological investigation, starting from an ordinary ultrasound to that of PET-CT, that's an advanced investigations, are all helpful in ovarian cancer diseases. When we talk about ultrasound, which is very important, as of now we have color Doppler ultrasound, which gives us a lot of information about the characteristic features of an ovary, by which we'll be able to diagnose whether it's a simple ovarian cyst or whether it's a malignant ovarian cancer. That is very important. The features, the characteristics which we see on each of these scans tell us whether it is a cancerous ovary what we are dealing with, or whether it's a benign ovary. The next thing is, what I want to mention is, if the patient is suspected by radiological investigations to have an advanced ovarian cancer, what I mean by that is, if the disease is spread throughout the abdominal cavity, then a simple needle biopsy, putting in a needle under guidance, radiological guidance, and trying to take some tissue to find out what type of tumor is more than sufficient. That is an advanced disease. If you have an early disease where the disease is confined only to that of the ovary, needling, putting a needle under guidance is not to be done. The patient needs to be either taken up straight for that of the surgical procedure, and then the whole ovary needs to be removed in toto, intact, without spilling of any tumor into the abdominal cavity, because spilling of any tumor into the abdominal cavity will upstage the disease. What do I mean by that? If the patient has not been spilled, if the disease is not spilled in the abdominal cavity, the disease would have been stage 1. By spilling of the disease will make it into an advanced stage 1 or stage 2, stage 3 disease, which is not to be done. So this point needs to be very carefully noted down. Once we know what the disease is and what our suspicion is, then we need to talk about the staging of the disease. If the disease is confined only to that of the ovary, we call it an early stage disease. If the disease has gone to the regional lymph nodes, we call it the stage 3 disease. And if the disease has gone throughout the tummy and if it is spread to other organs, then we call it the stage 4 disease. If it is spread to other organs and other things, and sometimes we can also have the disease in the lung, some fluid can be there inside the lung, we call it as a pleural effusion. That is all mentioned as a spread of disease. But these patients can be treated, and some of the patients can be also cured of this disease, is what is important. Now, when we talk about the treatment component, it is always a multidisciplinary treatment approach for these patients. What do I mean by multidisciplinary treatment? The patients definitely will need surgery. They will also need chemotherapy. This needs to be decided when the patient walks in and once we have completed all the investigations. the team which is available in our hospital, the multidisciplinary team, all of us combine together, then take a decision of whether the patient needs to be taken off for straight surgery or whether the patient needs first chemotherapy to reduce the bulk of the tumor, and then we take up the patient for surgery. Both are important. Generally, all these patients do very well. Only if the patient is very weak, we will not be able to treat the patient, or else we treat these patients very well and the results are also good. As I mentioned to you earlier, 70% of these patients present out with advanced disease, either stage 3 or stage 4. Throughout the world, that is the scenario. And very few patients present out with the early stage. Patients presenting out with the early stage disease have excellent results. And usually about 75 to 80% of the patients are long-term survivors if the disease is caught in the early stage. If the patient is coming in the stage 3, then only about 30% of the patients are long-term survivors, and the patients will be able to lead a normal life. In our hospital, for these locally advanced stage 3 diseases, we do something called as a hyperthermic intraperitoneal chemotherapy, which is a very unique thing which is done in our hospital, because generally chemotherapy will be given by that of an IV route. Here what we do is, during the time of the surgical procedure, when we are operating on the patient, we try to give the chemotherapy intra-abdominally with the abdomen when it's open. We try to heat the chemotherapy and we try to put the chemotherapy inside the abdomen for about 1.5 hours, wherein microscopic cells which are there, which are inoculated into the peritoneal cavity, will be destroyed by this intraperitoneal chemotherapy approach, which is coming up in a very big way in the other parts of the world also. These patients do have a life after the treatment. They do very well after treatment. Again, very important thing is follow-up of these patients. These patients can be evaluated with the help of something called tumor markers, CA-125. They can be used for guiding us whether the patients are having any recurrence or anything. It is very important the patients are on follow-up to find out whether any recurrences of the tumor, whether they may develop some other tumors also. They need to be on close follow-up with the physician and surgeons. Thank you.